Today I'm running workshops on lacrimal syringing, which is a procedure that can be done easily by optometrists in practice, but to date is not something that's routinely done. And I think one of the main reasons for that is a little bit of fear of doing the procedure. It's a little bit more invasive than the typical things we would do in optometric practice. The workshop today is really about demonstrating to optometrists that it's something that they're all capable of doing and about breaking down that fear and that barrier that people have in their heads about it. The purpose really is to flush fluid through the tear drainage system. The tear drainage system is what's called a cannuliculus. It's like a little tube that leads from the opening in the eyelid, the little punctum, down into the nose, and there are various sections of that system. What we do with this procedure is put a little cannula, it's like a little needle, through the first part of that drainage system until you get to the point of the lacrimal sac, which is right beside the nose. And when you're at that point, you literally flush through some sterile saline, and if there's no blockage, the fluid will come through either down the nose or more commonly into the back of the throat. So you're flushing through that liquid to make sure that the drainage system is patent and working, or you may actually flush through a blockage by doing that. The procedure itself is not painful. The patient may experience a little pinching at certain points during the procedure. If there's pain experienced, then either the procedure is not being done correctly, or there's something more serious amiss that is not going to be managed by this procedure. But that would be very rare. We do use anaesthetic during the procedure, although it's not absolutely necessary. The main, benefit of using the anaesthetic is to cut down on the patient's feeling to need to blink. It makes it more comfortable for the patient and the practitioner if the patient is not blinking all the time. The principal indications for doing lacrimal syringing is if there's a symptom of epiphora or excessive tearing. And so you're going to try and establish what the cause of that is. So in a way, the technique or the procedure is a diagnostic one to try and establish if there's a blockage in the tear drainage system, and then if so, where that blockage is. In the process of doing that diagnostic technique, you may well actually solve the problem by clearing a blockage in the tear drainage system. One of the common causes would be if a patient has say chronic or recurrent infections, or even just a once-off infection that can leave some, a plug of mucous material, for example, in the cannuliculus or the tear drainage system. If it's a more ongoing chronic problem, it could be something more permanent, like scar tissue or fibrosis. Something like that is obviously less likely to be cleared or solved by this type of procedure. But by doing the procedure, you'll establish the nature and the position of a blockage, and if it's something that's not solved by this, you're in a much better position to educate the patient about what their options are and refer them onwards for perhaps surgical management if needed. It's a great thing to be able to do, and it's very fulfilling to be able to solve a problem for a patient with this kind of issue, because it can be a real quality of life issue for patients. If there's somebody who suffers this constant tearing, it's unpleasant, and they're very happy to have it resolved. So to be able to offer that as a practitioner is very fulfilling and very good for your reputation as an optometrist as well.
I really enjoyed the lacrimal syringing workshop. Obviously an experience both doing and being on the receiving end.
It was quite new. New skills to hopefully try and hone in practice, all being well.
It's hugely reassuring to do the procedure, but also an important aspect of the workshop is the practitioners acting as the patient, so they get to experience it from both sides. And I think that's very valuable when you go to do the procedure, to be able to educate the patient as to what their experience of that procedure is likely to be. There's an upcoming TLC conference in London in September, and this workshop will be run again at that conference.